Welcome to Dr. Patterson's research. My name is Gabriel Demolanta. I'm here to teach you one of the most important aspects of this research, which is administering the EEG. Okay, right now we're going to talk about setting up the computers for the EEG. What you'll need is the laptop, as well as turning on the computer 1. First, you're going to need to turn on the NeuroScan stim box and the 2 amplifiers, all of which have switches in the rear. And you'll know that they're on by the lights. After that, you're going to have to plug in the stim key, which is this purple USB key right here, and the amplifier USB cord. Once you have that set up, you're ready to activate the programs for the EEG. You're going to have to open 3 programs in total, 2 on the desktop, computer 1, and 1 on the laptop. The first program you're going to want to open up is Stim2, which is indicated by this icon, this checkerboard icon. After, you're going to have to open up Showtime, which is in this Showtime folder and is indicated by this colorful icon. Once that is on, you're going to move to the laptop and activate the NeuroScan program. The NeuroScan program is shown as the Scan 4 icon. Once you turn that on, you're going to press the blue play button and the Z. After, you'll see all the channels are pink and you're ready to start gelling the cap. Before you start gelling the cap, you're going to need several items. First, you're going to need the gloves, then the isopropyl alcohol, which when combined with the brush will be used to clean the scalp. Then you're going to need the measuring tape, in which the centimeter side will be used to measure proper EEG cap placement. Then you're going to need the syringe, needle, and electrolyte gel. When setting up the syringe, you're going to make sure that the needle is not attached to the tip before you try to gather the gel. Once the gel is gathered, you can apply the tip. Afterwards, you're going to need the cotton swabs and the New Prep abrasive skin prepping gel, which will be used for the facial channels as well as the mastoid channels. When prepping that, you're going to need the adhesive colors, and lastly, you're going to need the foam ear tips for the hearing aspect of the EEG. Before putting on the cap, you're going to want to do 2 things. One is measuring with the measuring tape on the centimeter side, and you're going to need to clean the scalp with isopropyl alcohol and the brush. When measuring with the measuring tape, you're going to want to measure from 2 points. The nasien, which is an indentation between the eyebrows and the nose, and along the head you're going to find a protrusion called the inion, and that's where you'll cap the measurement. Once you have that, you'll have a total measurement. In my case, it's 35 centimeters, and at the halfway point, which is 17.5, will be where the CZ channel is supposed to be located. Before putting on the cap, remember to brush the scalp with isopropyl alcohol so that it makes the gel preparation a lot easier. And once you're done with that, you can put on the cap. once you have the cap on and the chin strap on, you can remeasure to make sure that you have the proper CZ placement on top of the head. And once everything is all aligned, make sure to attach the adapters in the rear. In this case, this cap uses two different adapters and they're labeled accordingly, connector 1 and connector 2. Once the adapters are done, you're ready to start gelling. Before applying gel to the rest of the cap, there's two channels that you want to focus on first. There's the ground and the reference. You want to fill these in first using the same technique that you'll be using for the rest of the channels, which is 2 fingers on the side of the channels and a circular and side-to-side motion when applying the gel, so that here can be cleared, allowing for easy access to the scalp. Once you finish both of these channels, you can move on to the other channels, making sure to be gentle and as courteous as possible. Make sure that you ask the patients if they feel any discomfort throughout the whole process. Eventually, you're going to get to a point where you're going to want to put the eye channels on, which are these points right here. Before you do so, however, you're going to want to use the abrasive prepping gel, which is used for cleaning alongside the cotton swab. You're going to clean the spots where you're going to apply the eye channels along here, 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 and here. The eye channels are pretty specific. They have 2 horizontal ones, which are the HEO-GR and the HEO-GL, which go along the sides. And then you have 2 vertical ones, which go above the eyebrow and below the eye. In order to attach these, however, you're going to need the collar attachments, which are these right here. You take one out, choose an eye channel to apply it to, and you apply gel directly into the channel. Once that is done, you're going to remove the cover and apply it to the spot that you're working on. Okay. Then you want to apply some gel a little bit afterwards, just so that the channel is completely filled. This shouldn't take too much technique as opposed to the other channels filled on the cap. While finishing up the gel preparation for the cap, you're eventually going to get to a point where you want to do the mastoid channels, which are M1 and M2. The prep for them is very similar to the eye channel preparation, but in this case you have to find a special spot which is located behind the ear on a bone. And once you've located that spot, similar to the eye channel preparation, you're going to want to clean it with a cotton swab as well as the new prep abrasive gel. And using the same collar attachments on the channel, you apply gel directly into the channel and stick it to the spot where the mastoid is supposed to go. Once you do that, you can do the other side where the other mastoid is located. One of the last steps for the gel cap preparation is inserting the audio for the test. In order to do this, you're going to need the foam ear tips, and
they are detached. Here's one example, one detached foam ear tip, and here's the example of the final product when completed or attached. Once that's attached, they're segregated by color, right being indicated by the red wire and blue being indicated by the left wire. When attaching this, you'd want to attach it to the shirt or collar so that it's properly stabilized. When properly stabilized, you can go ahead and insert into the ear, and sometimes it helps to ask the patient to aid in this effort, as they are the ones hearing the audio. So once that's adjusted and in both ears, you're ready to start testing.
While prepping the gel cap, you can tell if there's a good or bad connection by looking at the laptop. This is seen by the impedance scale, which is color-coded, with pink being the highest value for impedance and dark blue or black being the lowest level for impedance. The darker blue or black indicates a really good connection, and what you want is dark blue or black across the screen. Once that's completed, you can press the rectangular black button, which is stop, and press the green play button, which will show the graphs and also indicate good or bad connections. When that is completed, you can go back to computer 1. Under the options settings tab, you can load the settings for the specific test that you want to administer. In our case, it would be click. And once that is done, go back to the laptop, press record, and save the file under the proper name or under the proper folder of either patient or control, depending on who you're doing the EEG on. Once that folder has been created, you can save the file by name, date, and the specific test that's being done for the continuous graph. And once that's done, go ahead and save and start on the computer 1. The presets will stop the trials on computer 1 once it's completely done. In this case, it would be 180 for click. Once all the trials are completed on computer 1, you can go back to the laptop and press the stop button once everything is recorded.